you want to say? Oh, maybe that was error.
Sorry, it was an accident.
Okay, no worries, no worries. So, oh, perfect. Amanda looks perfect. So, welcome everyone to our session on digital inclusion at Leeds Community Healthcare, and thanks especially to Amanda for agreeing to do this. And just the backstory, in case anyone doesn't know, there is a Future Nurse Community WhatsApp group, which is quite an active group, and I posted on there a little while ago a tool which I will pop in the chat in case it's helpful for people, which was something from a university in the southeast, a health literacy geodata tool that I said, oh, this might be useful for people. And Amanda responded saying, oh, this looks really interesting, and I'm doing stuff on digital inclusion, to which we had an amazing, lots of people interested. So we said, well, why don't we just ask Amanda to do a webinar on this, because this is Future Nurse is a sort of self-forming group from people who want to share and learn together. So anyone else who's got any really good things happening in the nursing, or actually in the digital space, that would be helpful to nursing, these things are very easy to do. All you have to do is, if you've got a topic that people are interested in, we can help you just to spread the word, and you just do a team session. Because let's face it, in the NHS at the moment, the last thing we want is duplication of effort. So I think share, learn, and I've used the phrase for a long time, pinch with pride and acknowledge your source, so that we don't continue to duplicate. So I'm going to hand over to Amanda, because I'm sure you don't want to listen to me. I will pop the health literacy tool in the chat in case it's useful to anyone else, and we will pop things in the chat as we go along if there are interesting things. Also, if you've got questions, pop them in the chat. We will have, after Amanda finishes presenting, I'll try and pick up any questions, but people can come off mute as well and ask questions. But if you want to jot them down while you remember, please do so. So Amanda, over to you.
Thank you, and thank you everyone for being so interested in the work that we're doing. So I'm more than happy to talk about it. So my name's Amanda Jackson. I'm the Associate Chief Clinical Information Officer and Digital Inclusion Lead at Leeds Community Healthcare. That's a very long title and organisation. I'm a nurse by background. I'm an adult nurse with a specialist community public health nurse, so I'm a health visitor as well by background. So I'm going to, like Breid said, I'm going to talk to you today about digital inclusion in practice, not as policy, not as a strategy, but as something that we do that kind of directly affects patient care. I'll talk you through kind of what it looks like, why it matters, and what we've done at Leeds Community. I'll shorten that to LCH, and hopefully you can pick up and, like Breid says, feel free to pinch with pride. So I thought I'd just start with kind of the scale of the issue. I'm sure some people have seen this. This is done by the Good Things Foundation, and it's the Digital Nation. So we know that digital exclusion is still really widespread in the UK. We know that millions of people don't have access to a device, can't afford connectivity, or don't have the skills or the confidence. And it's not just about convenience. We know that it directly affects how people access services, and that includes health. So on this slide, you can see that the river represents the divide. And on one side, you've got people who can access services easily. They can book appointments, they can use apps, they can manage their care online. And then there are people on the other side, which is the orangey, reddy side, that are struggling to engage at all. And the key point to recognise with this is it's not a small group. It's often the same people who we know experience poorer health outcomes. So we know that digital exclusion doesn't just sit on its own. We know that it reinforces kind of those existing health inequalities. We also can see that public expectation has shifted. People expect services to be digital, but the support around that hasn't necessarily catch up. So we're hoping that at LCH we've started to navigate this a little bit and create a system where we can support people. But essentially, I guess across the NHS, we've created a system and wider where digital is expected, but not everyone can take part. So we know that digital inclusion is not a side issue here at LCH. It's central to access and quality in community healthcare. We know that the people we support are often more likely to face barriers, and that includes our older adults, people with long-term conditions, and those who have complex or social needs. And as I said, as digital routes expand across the NHS, there's a real risk that people will struggle to access care if we don't support them properly. So at LCH, we've been really clear on one point, that our digital transformation has to improve access and health outcomes and not widen gaps. So for us, that means understanding each person's, each patient, each service user's digital ability and build support into everyday care. It means recognising that it's not just an IT issue, it's a shared clinical and operational responsibility. So we frame digital inclusion alongside quality and safety, and it's helped us bring clinicians and our partners with us. We've shifted away from the focus of assumptions and towards evidence-based and individual need, but also more importantly, we maintain non-digital routes where digital isn't right or preferred. So our aim is to support confidence, capability and choice rather than forcing digital use. And hopefully I'll be able to talk through that and things that we put into practice and show you some of our data as well. So we recognised early on that we needed a consistent way to understand digital abilities. We were probably, like most organisations, a lot of assumptions, a lot of proxy measures that weren't reliable and often missed kind of that real need. So we introduced a really simple screening tool within System 1. It sits within our About Me section. So, and I'll show you this in a second, we have an About Me that incorporates lots of different elements of a patient. So things around communication, reasonable adjustments. And the idea is that the screening tool on digital ability just supports a really short conversation around routine care. It focuses on practical skills and confidence, like using video calls, messaging and the internet. And also, really importantly, it captures that patient preference. So we're making this part of our routine care. It fits into all our existing assessments and hopefully it's not seen as any extra work. We know that it's helped in having this has helped us improve completion rates by having it fit into existing assessments, but also staff confidence. And really importantly, it gives us real data, helps us understand the need properly. We can share information across teams and we can target our support where it's needed. So it's helped move us from those assumptions into evidence and help us make better decisions about support and access. So this is our About Me tool that I mentioned a second ago. So as you can see, and this is on a test patient as well. So as you can see, this holds, we use System 1 as our EPR. This holds all the important information about a patient. So it has their contact details on there. It has their language, if they need any interpreters, their demographics, reasonable adjustments, carer information, and then just a little bit further down there's a couple of extra bits such as armed forces. I'm not quite sure who I had to bribe or what I did, but digital ability is just set in the middle. So I'm just going to play a really quick video which will show you how our clinicians would outcome just as I talk about it. So we know that one of the changes we introduced, and it was quite a big change, was introducing this routine screening tool. So we built it into System 1, like I said, and it is very much around a short conversation. So the clinicians click on the buttons and we ask them to talk to the patient about things like, can you use video calls? Do you use the internet? Are you confident using apps? And do you want to engage digitally? And the last bit's really important about them engaging digitally. We then code the records, and if they say they are unable to perform duties, like you can see on the screen at the moment, the clinician can choose some additional options, which give a bit of a better idea of what support that patient may need. That then is into the patient record, and you can see that that green tick is now there, and that says that they are unable to perform information technology activities. So what was also really key, and listening to staff feedback, was about that they wanted some immediate support that they could just give information on. So on that template underneath the green tick, you can see that for us in Leeds, a lot of the support is through our public library, so there's a telephone contact number there. And then there's a link for them to send a text message via the communication annex to our information hub if the patient's able to access that. But then also there's some information there about our digital health support hubs. and I'll talk about them in a second. But for us, hopefully you can see that just by integrating a screening tool, digital ability is now something that you can actually assess alongside things like reasonable adjustments, mobility, let's say. It becomes just part of that routine everyday understanding the patient. And we know that once we've got that information, we can then go on to adapt our care properly. So this has helped us move from guessing into evidence. So what's our screening tool telling us? So this is hot off the press. Our data is currently telling us that we have around 67.3% of patients that are able to perform those basic digital tasks, and around 32.7% of patients are unable to. So when we focus on those patients themselves, we can show that digital exclusion increases significantly with age. The majority of our 65 plus patients can't use digital services independently. That's around 1 in 2 over the age of 65 for us. But also, really interestingly, nearly 1 in 3 working age adults are saying that they are unable to perform those basic tasks. So clearly digital exclusion isn't just an elderly problem, and there are people within the working age bracket that require some support. We also know that language and ethnicity on their own aren't reliable indicators, which is why we know that assumptions don't work. So we have a mix of people whose English isn't their first language that are able to perform duties. We also have a mix of people where English is their first language that really struggle with some of those tasks. However, what our data shows us is that we can identify those, which means we can action it. So by screening routinely, so I ask all our clinicians, to do it on their first contact with the patient, and that's irrelevant of whether it's been asked previously. If it's been asked, obviously, the week before by a different service with an LCH, then we generally say you won't need to ask again the following week. However, it is understanding that maybe it's been a period of time, and that may have only been a month that they've been asked, and it's really important to just kind of check in with the patient, because we know that digital exclusion's fluid. People may be able to afford, let's say, their broadband contract 1 month, but may not be able to afford it the next month, or something else has happened. So it's really about our staff making sure that they continue a conversation. But what we know is by screening routinely, we can plan support properly rather than reacting when any digital route we implement fails. And this data helps us underpin everything that we do. So our support hubs, our partnership working with other organisations, but really importantly, how we design our services. So we know that all our digital transformation improves access, like I was saying before, rather than widening our gaps. And that it's everyone, I like to say it's everyone's responsibility is digital inclusion. It's not just a project team, it's not just an IT issue, it's not those of us in digital roles, it's absolutely everyone across the organisation. So a little bit more information around our data. So we can see a pattern. Those patients that are more likely to struggle if they are 75 plus, if they live in our deprived areas within our boundaries and Leeds, and that they have multiple long-term conditions. Patients are often known to multiple services, so we know that they're seen regular, and we know that they're managing multiple long-term conditions. So they're really complex patients. So they're not low contact patients, they're actually quite high need patients, which then means that digital exclusion can become a clinical risk. If we're expecting them to do things digitally, and that may be follow up on an exercise programme, for instance, or input their health observations, if those digital systems don't work for them, we know that their care can be disrupted. We know that communication can break down, and more importantly, their health outcomes can worsen. So this again challenges those common assumptions, and that digital exclusion is not always about motivation, that sometimes it's about capability, health and circumstance. So what we do know is a key risk that a digital first or digital only approach may unintentionally widen those health inequalities. if they're not designed with our digitally excluded patients in mind. So patients who are unable to complete those digital tasks will struggle to book appointments, like I've said, or access information, or engage with anything like remote monitoring and communication. And we know that that then leads on to missed appointments, delayed care and poorer health outcomes, but actually also an increased pressure on our staff as they're trying to figure out workarounds. Our data shows that one model doesn't work for all patients. And while we have got an amazing amount of patients that can do and benefit from digital services, we've also got quite a significant minority that require alternative or supported routes. And it's always really useful to remember that even though we have patients that say they can do those digital tasks, they still may also need support. So we know that we shouldn't necessarily slow down our digital transformation, but actually it must be implemented through kind of a mixture of care models that combine digital, non-digital, and actually supported digital options. We talk a lot about kind of co-design across the NHS, don't we, and inclusive design. And for us, it has to be a standard requirement in any service that's redesigning their pathways. We make sure that they think how they support those that may need support to access digital. So it's about framing digital inclusion as a core quality and equity issue, and like I was saying, not just a technical or operational issue. And by addressing it proactively, we're hoping that we're reducing risk, we're having safer kind of digital service transformations, but also it really importantly aligns with our organisation's commitment to fair and accessible care. So one of the things that we're doing, our digital ability screening tool directly shapes what happens next for patients. So it's absolutely brilliant that we have clinicians asking those screening questions. But actually, what do we do if someone says that they require some additional support? So we work really closely with a brilliant organisation in Leeds called 100% Digital Leeds, who are funded by Leeds City Council, and they've set up a network across Leeds of third sector organisations and some kind of private organisations that will offer support. And this is very generic support, so it's around things like gifting devices, how to get people on using their kind of devices, but also things like data SIM card gifting, and all of that's brilliant. So we know that if someone's confident, we can support them to use digital routes independently. But actually, if not, our staff are able to offer help straight away or signpost to one of our digital health support hubs. So because we need to be able to provide direct digital health support to our patients, it's very much around what could we do. So I've set up our digital health support hubs. So we run them in community settings and city centre locations. So we've done one recently for anyone that knows Leeds, Leeds Market, which is right in the middle of Leeds city centre and has a huge amount of people that goes through it. And also some of our one-stop centres. So the one-stop centres are generally run by Leeds City Council, and it's where people can receive support from maybe benefits advice, housing support. They often have things like a credit union there, often libraries are based there, and some of our health services within Leeds work out of there as well. What we have done, and I've been really successful with, is introducing industry partners. So we work with AirLogic and Virgin Media O2 Business, who kindly provide us with staff volunteers as part of our digital health hubs. They have staff volunteer programmes respectively, and their staff are able to come and support us in our digital health hubs. So these staff are trained and really luckily often have worked on NHS projects such as the NHS App, so they're invaluable. But what are our digital health hubs? They're free, they're drop-in. They're somewhere where someone, one of our patients, our service users, or maybe their carer or a family member are able to get one-to-one support with lots of different things. So things like setting up and accessing the NHS App, booking appointments. So that could be through the NHS app, or it could be through various GP online services. We've got a right mix in Leeds. I don't know if anyone else has, but we have GPs that use patches. Swift is another one, Acurex, lots of different ones that can be really confusing for our patients. They can get help with video consultations, with accessing their device and connectivity. We can support them to make sure that they're accessing those safe digital health resources. And like I said, they're based in really community settings, so in their local area where people can hopefully not travel too far to get to one, and we base them on our neighbourhood health models. I don't ask people to book online. I don't ask people to book at all. So hopefully that removes the barrier straight away. It's very much about people dropping in. And one of our key learnings is really simple, that technology alone isn't enough. We know that people need time. We know that they want face-to-face support when they're accessing digital. We also know that they want someone they trust. And hopefully by us within LCH and the NHS running these support hubs, we can provide that trust. So we started running them at the beginning of the year, and we've learned so much. We've supported around 250 people so far, and what we can see from this is that confidence builds really quickly when we know that the support is right and the support's available. So for us, digital inclusion, again, isn't a side project. It's now part of our everyday care. And I think the clinician in there is very much, it's brilliant that we have a screening tool, but what is really, for anything that we screen, our staff wanted to know where they could actually signpost people to, that they knew, again, as a staff member, it was run by someone that they trust or run by an organisation that they trust, and that actually that clinical time is spent undertaking the task that they're there to do, perhaps in that patient home, rather than maybe setting up someone on their phone to access the app and things like that, which staff are still doing in the moment, but actually we can support our staff to signpost direct to these health hubs. So I just wanted to show you some feedback that we've been getting. So each of these direct quotes have got a story behind them. They all visited one of our hubs and were asked, what have you found most useful today at the Digital Health Hub? So I'm just going to run you through 2 or 3 of the case studies. So the speech from the quote from the bubble in yellow, sorry, I can't speak, was about a young mum. She was mid-30s. She had a gorgeous little 3-year-old with her, but she'd been urgently referred to gynecology. She already had the NHS app. She thought she felt quite familiar with it, but actually she was just really confused about what had happened. She'd got an out-of-area appointment, and it was for a hospital that was a good 20 miles away. She didn't drive, so she would have been relying on public transport. And then she could see in her NHS app that there was a referral for an ultrasound, but it was with a different GP surgery, and she was really confused over what was happening. She tried to ring the GP surgery, and the receptionist was unable to help. So she was just happened to be in Leeds Market, and came over and had a conversation with us. So what I was able to do is, with her consent, show her how she can access those GP records and consultation, and actually help her understand why it was 2 separate referrals and what that looked like. And actually what had happened was the GP had referred her for an ultrasound scan, the pelvic ultrasound scan, and they are done locally at various different GP surgeries in the hope that that appointment would come through before her hospital appointment, so that when she went to the hospital appointment, her scan results were there. Now that's brilliant. That's absolutely what we want to happen. But actually it just really confused her, and she was really anxious about that. So what we were able to do was understand that what had happened a little bit more. She needed to rebook that scan appointment that had been booked because she was working and couldn't attend it. So we were able to do that. And also what we were able to do was, after explaining kind of why the hospital referral had looked the way that it did, was change that hospital appointment to one that's in Leeds, that she could just get one bus to, that was 15 minutes down the road. which is life-changing. She'd spent a few weeks, she said, being really worried and anxious, and had actually missed one of her hospital appointments as well. So that was a really good outcome. So the one in the top right, that's in a very interesting green colour, was about a 74-year-old man who had no email account, but he'd got a smartphone and he did have access to the internet, and so he had data. But he'd received a text message from the GP surgery that was telling him to book an appointment online, as they wanted his blood pressure and to share some of those observations. He had absolutely no idea how to do this, and he tried ringing a couple of times and was unable to get through. So the team from AirLogic, a member of staff from AirLogic and one of our LCH staff spent 2 hours with this gentleman, setting him up right from the start with an email address, helping him get access to that on his phone, download the correct apps, all of those, to then be able to access and download the NHS app, to then use patches the GP request to send his blood pressure information through, and to request an appointment, but also took that opportunity to have a conversation with him around staying safe online. So just one of those in the moment appointments, conversations, which is brilliant. So he then walked away feeling really confident in using tools. And then lastly, we had an 81-year-old man who was deaf. He changed his device recently, and for anyone that's done that, if you have the NHS app, it doesn't always like you changing your devices. So he was really struggling to get back online. He'd been to the GP surgery 2 or 3 times, and they told him that he just needed to sort out his password. His words, not mine. And he really struggled with this. Now, coincidentally, I am able to use sign language. I grew up with deaf parents, so he was able to come along. He'd seen it advertised to our support hub. And we again spent a considerable amount of time trying to get him back online, but actually I had to ring the GP surgery to liaise with them regarding his access, all things that he would have really struggled to have done himself independently. It turned out that while we were there, he'd got a text message from his GP, and also had another health concern that he wanted an appointment with, but the GP, he didn't quite understand how to use patches. So we were able to go through patches, book an appointment, and also show him how to order his prescriptions online. So we've got lots of amazing case studies in where our screening tool has led to our digital health hub, and people attending them. And I guess for us, it shows us that digital inclusion isn't a one-size-fits-all. So we know that we have to adapt to communication needs. So thankfully, with our partners, we're able to provide interpreters, and we try and base this on the areas that we're in to try and understand the languages that are spoken in those areas, and we'll bring interpreters with us. We know that we need to adapt to confidence. Sometimes people do have those apps, but just don't know how to access them or use them, but also ability. And actually, when we do engage our patients, we know that they engage with digital much more positively. So just to reiterate, when we get it right, we know that the impact's really clear. Our patients are more confident. They're also more independent and more empowered, and that they engage better with digital health services and health services in general. For services, particularly within us, but actually I think there's a greater good here. I'm a massive believer in, I don't ask people if they live in Leeds, if they come and have a conversation with us at one of our health hubs. If we can support anyone to get online or to access health and digital, then it's kind of regardless of where they live online. Just don't quote me that to the board. But yeah, for our services, we know that there's fewer missed appointments, that we've got better communication between services and our patients. So a few of our services from System 1 send various messages through our communication annex, but also can send patient questionnaires. So we're able to have those conversations with patients in our health hubs and through our screening tool, and explain how people can interact with that and send us information. And that helps during those clinical conversations. So for the wider system as well, there's a benefit and an impact. So we know that we know that we're supporting that safer, fairer and digital care, and that all of this work supports both experience and outcomes. So I talked a lot about what we're doing. I thought it would be really useful to just show you kind of our pathway as an overall view, because what I haven't mentioned is what it starts with, and what our pathway starts with across the organisation, and really is key to embed this, is staff training and resources. So we work alongside, like I said, partners, 100% Digital Leeds, and we provide digital literacy training across the organisation, and we have a monthly lunch and learn running, and then we offer bespoke sessions with services that feel that might be useful. So they're really key with helping us embed our work on digital inclusion. We've got staff intranet pages that have a wealth of information on there. There are lots of amazing organisations in our communities, not just Leeds, so places like AbilityNet and Age Concern that work across kind of England, that will offer some support around digital inclusion, and some of them even go into patients' homes that are housebound. We've also got a brilliant Leeds Community Health digital network that's built up of our staff. And they really help us embed not just kind of digital inclusion, but all of our digital kind of innovations and digital transformations. But we always keep them in check with what's happening. Our second element, like I've talked about, is our identification and assessment, our screening tool. And when I am doing training, I try to make this a little bit more relatable for our staff. So the health visitor in me, when we've done training with 0 to 19, one of my first questions is, and I wonder if anyone in this call can resonate with it, we're all really good at sending maybe messages, text messages from our EPRs. So as a health visitor, I will have sent a text message linking a parent to, let's say, the Lullaby Trust. So I've gone in and done a really good piece of work around safe sleeping and how babies should be sleeping safely. So on their backs with nothing in their cot or their Moses basket. And then just to reiterate that, I'll have sent a text message to the Lullaby Trust, who are an amazing organisation that give lots of support. I will have previously, hand on heart, never thought, oh, actually, can they access that link? I'll have asked them if they've got a phone, but I won't necessarily have taken it one step further. So it's about making the conversations real to life for clinicians when you're doing training. And then following from that, we do lots of referral and signposting. So we've got lots of partner organisations that we can support that will help with devices, data sims, and some digital skills. We've got our patient-facing information hub and some easy read resources on there. And then the fourth element is our amazing digital health support hubs. They're at least monthly. We're now about to go into a summer period where we've got maybe 2 or 3 a month in various different things, various different areas. Like I say, we work really closely with our Virgin Media O2 and our Logic partners and volunteers, and they are amazing and brilliant. And then we support people to get online with those tools, but also, more importantly, it's about us being part of that collaboration and systems-wide learning. So it was amazing to get so much feedback from people wanting to know about the work that we're doing and that we can put on a session like this, but also sharing that information at various different networks. So I'm doing some national work with East London NHS on creating what good looks like for digital inclusion in terms of what trusts can do. So a real practical based toolkit, I guess. And then some of this work has also reached NHS England, and they're very interested in what we're doing. So I've just started feeding some work into that. So for us, hopefully you can see that digital inclusion is a full pathway: staff training, screening, referral and signposting, and we've got our support hubs, and then we've got that systems-wide collaboration. So for me, it's very much about digital inclusion not just being one single intervention. It's around kind of an entire system. And no matter what you're doing, your role fits into that system, and so does your organisation. So in summary, we start with our screening tool. So it's very much about us understanding each person's ability through regular screening and us not making those assumptions, to empower and make sure our staff are confident, and what's really crucial for them to achieve kind of safe and equitable digital transformation in healthcare. But also what I always say is we have to remember that our staff are also likely to be in those people that are excluded. So just bearing in mind that whenever we're having conversations around digital exclusion, that all of the areas to help patients feel digitally included are also really able to support staff as well. We had a recent clinical conference at LC8, and I had a pop-up digital health support hub there, and it was part of the day. So staff were able to go up and have conversations around how do they get online and how do they learn how to use the NHS app and those sorts of things as well. So that's really important and really crucial. We know that targeted place-based interventions such as our digital health support hub really help as well. And again, all of these lessons I hope are transferable, not just across kind of community settings, but also across acute settings, and they align really closely with kind of the NHS ambition to deliver inclusive and personal-centred digital care. So for me, really quickly, we know that digital care will keep expanding, but actually the principles of nursing and health don't change. We assess the person, we try and remove those barriers, and we make care accessible. And digital inclusion is just a part of doing that really well. Thanks for listening, and happy to take any questions.
Thanks, Amanda. Wow. I mean, it's so interesting because you're talking about digital literacy, but you're also talking about health literacy. They're sort of inseparable. That hub sounds like it's such a valuable resource. And also the thing I got was about the amount of collaboration between partner organisations. It's a bit like it takes a village to raise a child. It obviously takes a village to really deal with digital inclusion and health literacy and things like that. So really impressive work. I'm going to feel better about paying my Virgin O2 bill from now on, now that I know they're contributing to things like this. I'd encourage people, pop your hands up if you've got any questions or comments, or indeed if you're doing anything in this space that you'd also like to just mention to people, because this is about learning and sharing together. I've got one. Oh, actually, we'll go to Laura. In fact, Laura's point in the chat was related to my question. So I'll let Laura go and then I might add to it.
Hi,
Laura.
Hi, Amanda and Breid. Thank you very much. Wow, that's really inspiring. I'm trying to do a little bit like that down in Sussex. Also lots of collaboration. We have got a digital inclusion policy, which is a great start, which also enshrines that we start with a digital inclusion report when we start off a digital transformation project, and that really helps us to kind of understand what the tricky points might be for patients and parents and carers. And we sort of build from there, and we try to also use that as a basis for a user research plan. So we then go a bit further and sort of do some direct user research with our patients. Yeah, really interesting what you've brought up, and I feel really inspired with the screening tool you've built into the system one. So I'm just working on the reasonable adjustments digital flag, which is a very similar thing.
Yes.
Yeah. And you've given me some great ideas on how I might be able to, because again, it's all about me, or about me, as we'll call it, and sort of including that. But we're also just talking to the NHS App team about they're sort of talking about including the Red Book, digitizing the Red Book as part of the NHS App, and thinking about a pilot with us. And it sort of made me realise there are some sort of opportunities maybe when, for example, when GPs start to enable that proxy access for parents, that could be a good touch point at which they then also give out information about the digital skills support that we have down here in Sussex. It would be a brilliant way of encouraging our health visitors to maybe do a short assessment of digital skills or indeed access to data. So yeah, you've given me loads of ideas. I'd love to chat to you a bit more.
More than welcome. Email me.
Fabulous. This is exactly what you want from these sort of events. Can I add to, so Laurie, your post in the chat and made me think, Amanda, when you do the assessment in System 1, that's then available to anyone that interacts with that patient, that assessment has been done, which sounds great. And that, I think, is a step probably more than most people have, because a lot of people do them as point assessments that then don't sit in a record. So that's really good. But then you have this wonderful intervention where, you know, the case studies you did gave where people are now much better and feel much more confident. Do they then revisit and change that to say, actually, I'd like to, do you encourage them to say, next time you have an interaction, tell them to update your digital skills because you'd like to be able to interact digitally?
Yeah,
how does that work?
You're absolutely right. It's not, and throughout our training sessions and conversations, it's not about this just being a one-time only assessment. It has to be ongoing. The public health nurse in me, and I'm sure you're all the same, knows that how someone might answer one month might it be very different to something, you know, that happens even a day later, or, you know, or a month later. So a bit like you, Laura, I trialled this when I was working for 0 to 19. So, like I said, my background's health visiting. So we've very much gone with user-centred design on these questions, not only from a patient perspective, but also from a staff perspective. But it is about kind of recognising that this isn't a one-time only ask the question. It has to be part of an ongoing conversation. But actually, those ongoing conversations may not necessarily need to be as big as the first conversation. Does that make sense? So it might be for maybe a nurse who is doing a wound care with one of our neighbourhood teams, district nursing teams. It might be that they've had that initial conversation and they're saying that they're unable to, but they've signposted them to different organisations that can help. And then maybe a couple of weeks later, the next time that they're in, they're doing their leg dressing. It's about revisiting that conversation. Also, we talked, and did you manage to get any help? You know, so it is about kind of revisiting it, isn't it? But actually, for those patients that have got multiple services in, those services can continue those conversations because the likelihood is that they're all not going in on the same day. So there's a little bit of a fine balance there, and it is about recognising it's never a one only kind of conversation.
Absolutely. There's lots of asks in the chat, and I know about sharing things. So Laura, there's a question, can you share the document that you referred to and Amanda is about your dashboard and about the documents. And I know you had a problem sharing the document, perhaps because of size. So, and can we share the slides? So yes to the slides. But can we share, are you able to share the model or the documents relating to it? Or is that still a problem in terms of size of the document?
I think it was just on WhatsApp, so it should be fine on email. If not, I'll figure out a way around it.
So I'm always cautious, having encouraged you to do this. I don't want you to get 25 emails and end up with a huge inbox and lots of work. So one thing is perhaps if you can send them through to Jules at Future Nurse and she can send them out to people who've registered on the webinar, just as because I'm always, you know, people put their hand up and their head above the parapet and do things like this and then end up getting so much work to do. Or we could ask Natasha about putting them on the Future Nurse site, but whatever works, we will get you the documentation that you've asked for or the resources. So Laura, maybe the same for you if you want to send it through to Jules and we can send it out through the those that registered. Linda, do you want to come off? Got your hand up?
Yeah, just trying to. That's it. Is that okay? Oh no, it's not coming. Can you hear me okay?
We can hear you.
We can hear you.
Sorry,
Yeah.
it doesn't seem to want to Anyway, so the question, oh, there I am. So thank you so much. I had to join late, so I'm not sure whether you'd already covered it. So really, really interesting. Thank you for presenting that. Obviously, this is sort of community focused, and I absolutely can see the need and an ownership there, you know, around that linking with GPs and everything. I just wonder what the link with the acute sector is, and even staff there being able to see it, because I think, you know, the patient's journey sort of, you know, covers it all. Can it start there? Can they have vision of it? Obviously, in the hospitals, they probably wouldn't have access to System 1. But I just think, again, you know, if people are coming for outpatients, even coming into hospital, it'd be really helpful just to be able to see some of the really good work you're doing rather than having to be duplicated, because I know digital inclusion is sort of important to everyone. And if you'd previously mentioned it at the beginning, you know, apologies if I missed that bit, but really, really interesting. And I hope it does. And Laura, you know, even what you're saying, you're already beginning to see use cases. There's different groups out there that we may not always think, because I think we often have this focus, don't we? It's around acute hospitals, it's around those nurses, but, you know, you're talking about sort of, you know, health visitors and, you know, that sort of, that the midwives, you know, all people like that, really important. But I just was wondering, is there a link, or do you envisage a link where that can be visible to an acute setting, whether it be outpatients or on the wards, or could it even be started there or something? Thank you.
A really good question. So yeah, you're right. They don't necessarily have access to the finer details of our System 1 in Leeds, which, you know, we're on Yorkshire and Humber Care Record, so there may be a way that we can look at kind of flagged alert data, but definitely the support hubs and the information around that is a Leeds system wide. So for those of you that don't know, Leeds Community Healthcare are about to be acquisitioned by Leeds and York Partnership Foundation Trust, so we're coming together. So we'll end up with 2 trusts in Leeds, so the acute and very much Community Mental Health Trust. So we're having, I have conversations with both of them around let's share these health hubs, because like I said right at the beginning, most patients that are under the acute trust will be in no doubt some way, shape or form one of our patients, but actually it doesn't matter, does it? It doesn't matter where they're a patient. And actually, to some extent, if you're someone who lives on our bordering and you just happen to be in Leeds Market and we can support you to get online, then let's do that too. It's very much about sharing kind of the greater good, but like you say, not replicating as well. I'd love to have a health hub in one of the hospitals. Maybe that's my mission.
And actually, Amanda, can I just add to that? I mean, there's nothing, you've built this tool in System 1, but there's nothing to say you couldn't build this tool, because actually what you want is whether they go through, where the first interaction is an acute mental health community, you could build it into any APR and share it, you know, with the shared patient record or whatever, a single patient. Yeah. So actually got lots of people thinking, I'm sure.
I know that some GP surgeries in Leeds have started to use the same tool as us, because I mean, and admittedly they're on System 1, but yeah, that they've been able to kind of create the same questions. But yeah, you're absolutely right there, Breid.
And Laura, you wanted to come back in?
Yes, I was going to mention the shared care record as an opportunity to share these things, but actually the reasonable adjustments digital flag that's coming in will establish the preferred method of contact, which is going to be really, really useful, because it will state whether the patient is happy to receive SMS, email, or whether they require a letter or a phone call. So it will definitely help with sort of establishing someone's communication needs.
I think it's also just being mindful of that as well, though, isn't it? Because we absolutely want patient preference, but actually some people might say they don't want digital because they don't know how to, or don't want any support. So you're exactly right. It's about that wider conversation as well, isn't it? Around that. But yeah, that would be really helpful.
And it is interesting, because I immediately think of reasonable adjustments as something that might be that I've got a disability or something, whereas actually digital might just be I've got an information gap. Yeah. It's sort of an interesting bit, isn't it, what words mean for you. We also, you talked a little, you responded in the chat, I don't know if you wanted to say anything more, Angela or Amanda, about the question about workforce, you know, because digital literacy is not just a patient.
And I think our screening tool data shows that, you know, that 1 in 3 working age adults from our screening tool requiring some form of support. So our training teams have within our organisation are now offering things like basic digital skills training that's face-to-face that people can access whenever we've kind of got any I want to say systems-wide events, so a bit like our clinical conference or things like that happening, I always make sure that we take a tech bar and some of our digital skills support there. So we're just starting to delve into this a little bit more, but like I say, whenever I do any inclusion training, it's a conversation I make sure I bring up, that staff members can come and access the digital health hubs. And actually we did one a couple of weeks ago at a health centre, and I had a staff member who's one of our receptionists come up and spend some time with me and just go, I don't get this, I don't know how to use the app, it's really frustrating. So it's just about, I think, making it as open as possible and saying that it's not just for patients.
Yeah, I've just randomly, because I realised Amanda and I both agreed it would be helpful to promote the work that's being done through University of Salford. They're doing a user survey on the generative AI for inclusive digital health, because I think we've got digital health inclusion now, but my gosh, with AI does it become even more complex. So I think the more people that can contribute to that user research, the better. So I popped the link in there in the little flyer about it, and there's, if you scan the QR code that's in the document, you can find out more or get in touch with them. And Amanda, they're also doing an hackathon on the 20th of July. You seem to understand that more than I did, so I don't know if you wanted to speak to that, but there's a couple of places left which you can register via the link.
I know what hackathon, purely because again, back to the staff literacy, I run co-pilot chat hackathons. For our staff, and we do that very much around digital. So yeah, it's a very good premise. So yeah, people please get involved with that work.
Yeah, it's on the 20th of July. I'll just pop that in the chat as well. They're on hackathon, so there's a few places left if anyone wants to get involved, because you're obviously all interested in digital inclusion and digital health inequalities. Because digital is an amazingly inclusive opportunity, but it's equally an amazingly isolating opportunity.
Yeah, absolutely.
So we've got to get it right. Any other questions from anyone? Lots of positive feedback, Amanda, so thank you from everybody in terms of agreeing to do this.
More than welcome.
Dawn has said, would be happy to have it be a link if you're wanting to expand this to your bordering health. Dawn, come off your mic and say that.
And I'm like, where are you from?
Yes, Dawn, come off camera. We love this linking up across boundaries. And
Bradford. Yeah, Bradford.
Bradford District Care Trust. So we're community, same as you, Amanda. We're community health and mental health services. So if there was an opportunity to expand that around, would be fantastic, because we are same as you, we're in re-procurement process, and it would be brilliant to bring some ideas on board. Definitely.
More than happy for you to get in touch with me, Dawn. That'd be
fabulous.
Good.
Lovely. Thank you, Amanda.
Back if you join up, because it just shows the power of connection for even greater good. So I think with 4 minutes to go, I think it's probably time to draw it to a close, so everyone can have a time to go to the loo or get a glass of water before their next call. But thank you, Amanda. Thank you, Laura, as well, for coming, and sharing some of your work and agreeing to share resources. And if we can then share, both of you share them with Jules at Future Nurse, we can then get them out to people, and the slides as well, Amanda. But I've no doubt you're going to get emails anyhow, because it's people are so interested, which is wonderful for our patients.
Absolutely. Yeah. Thank you, everyone.